Good afternoon. Today's numbers show us that the situation is under control in our hospitals. So we're concentrating our efforts in nursing homes where the situation is critical. The lack of staff remains our biggest concern. I want to thank especially the 2,000 physicians who answered my call for help since yesterday. We're doing everything we can to get through the emergency. It won't always be perfect, but it's time to unite all together and win this collective battle. So courage, everyone. Good days will return. Thank you all.
Good afternoon to all of you. Dr. Haruda, I'm sorry for your loss of this young colleague of yours in health, community health. You said it. The news is out, and with this news comes lots of fears. What do you say to Quebecers and healthcare workers?
Okay, first of all, I want to say that when I talk about numbers of people dying, I know the drama that is going in each family for each colleagues and loved ones, first of all. And I think this case is like, I would say, the impact in families that is the same as others, even if they are older or that. First of all, for the reasons of confidentiality, I don't use to comment about one specific case. But what I want to say, because it's already in the media, and because people are going to healthcare, people are going to shared facilities, they will think that the healthcare worker is at a higher risk when he's caring. It's clear, but they protect themselves too with different things. This health worker didn't work in, I would say, hospital or long-term care facilities. You get the disease somewhere else. So it's one I want to say that we must remember that those regions are at risk for people who are very sick and are, but you can get the disease elsewhere. So be careful and just listen to the recommendations we give. So because the virus is transmitting inside of healthcare settings, especially long-term care facilities. And we see the big impact on the elderlies. But at the same time, you can get it at work if you don't respect distanciation and if the people are symptomatic. So it's why we are telling people, please listen to this thing. And if we do reopen things, we do that in the way to protect everybody.
Okay, second question. With canceling of non-urgent surgeries and clinic visits, you've been saying that hundreds of beds are available for COVID patients. There is a VP with the FIC. Her name is Denise Joseph. She says that that means that nurses are being sent home because there is no work. So why in the strategy these nurses that were available have not been called first instead of sending messages that we need people, that we need orderlies, that we need specialists, that we need general practitioners? Why we've not focused on nurses that were available according to the FIC?
Well, the information I have is that we have called on nurses who are in the hospital sector to come and help in the long-term facilities, and I have concrete examples where it's been done. So we've done everything we can to get those nurses to come and help in the long-term facilities, and they have done that. So the outpatient clinic, we want to reopen them gradually. And also some of the nurses may be in first line, but some of the nurses in first line, they are in the clinique d'évaluation also. But yesterday I've asked the sous-ministre to call upon the PDG and ask if there are some more nurses that could be available in the outpatient clinics. Of course, it's a balance. Because the outpatient clinics will probably reopen gradually. But we're doing everything to get as many nurses as we can in the long-term facilities.
Next question, Samuel Pouliot, CTV News.
Hi. There are many former nurses and others with healthcare experience who have volunteered to help in the pandemic, but they didn't get any answer. Why is that? And why did Quebec ask doctors to help when so many were available and volunteered? Especially now that unions are criticizing the plan because it's unfair to pay. It's an unfair pay for those who do the job.
Well, the first thing I think to say is that what the physicians will be paid is inside their envelope. It's not an additional budget. It's already in their envelope. So we're not, putting out more money. That's the first thing I want to say. The other thing is that we need thousands and thousands of people, not just a few hundreds, thousands and thousands. So, of course, maybe some of the nurses, they fell between the cracks, but I invite them if, they want to be on Je Contribue, if they are outside of the network, for instance, we will, of course, follow up on their offer. But we did contact everybody we could, and there are a few probably that we missed, but we want them. So if they want to contact us through Je Contribue, we will contact them for sure.
Okay, and how can caregivers prove that they don't have COVID-19 to be able to enter seniors' homes to safely take care of an elderly or when testing, facilities will not test them unless they're not showing any symptoms?
Maybe I'll ask Dr. Arruda on this.
You must understand that they will work with masks, and so if they were asymptomatic and trying to spread, they will. If they get a story of exposition, they're going to be tested. But if they are getting and they have no symptoms, they will wear masks, and so they will not contaminate. And they will use, I would say, the hygiene issues. It's not only wearing masks. I always remind you, it's a way to put the mask, it's a way to take it out, it's a way of taking out your gloves and wash your hands.
Thank you. So now the next question are from Raquel Fletcher, Global News. The first one is for Mr. Legault. Alberta and BC have stopped staff at senior residents from moving between facilities weeks ago. Ontario stopped it as of yesterday. Why is it still happening here?
But first, we've asked all the people that were able to stop it since weeks. Of course, when we're short of staff, sometimes it's impossible, but every time it's possible not to have somebody going at more than one place, we're already doing it.
Thank you. The next question is for Dr. Arruda. We're hearing about many people staying positive for a long time after symptoms disappear. Why is that? Is enough being done to test healthcare workers?
Well, first of all, it's clear that we can detect some virus with tests even for a long time, but it doesn't mean that the dose, because for getting infectious, you must have a certain dose of infection. Most of the transmission seems to be done just before getting the disease, I would say less than 1 day before. It's what this new study is telling. And I would say during the symptomatic phase, and most of the time those persons are at least 7 days without having any symptoms before they can get it. So with this, I think we can lower the risk. And don't forget that the test is sometimes good, but it could be false negative, false positive. And when it's not during the catching up period of high circulation, it's more difficult to interpret the test.
Thank you. Now questioned from Phil Autier, Montreal Gazette, for Minister McCann and Dr. Arruda. We are again getting questions about testing. You have the capacity to test 6,000 people a day. How long will it take to test all the healthcare workers and residents in CHSLDs? It was promised a week ago, but does not seem to be happening. Can you explain why?
Well, we're giving priority to the CHSLD where there are eclosions. and to CHSLD where there are a certain number of cases. So that's being done now, and gradually, I hope we'll get to all the CHSLD, but we have to give priority to those who have cases of COVID-19.
And a very last question for Mr. Legault and Dr. Arruda. Theories are emerging about why Quebec and Montreal in particular have become the epicenter of COVID-19 in Canada. Why do you think this is the case? What are the factors to explain this?
But I think, first of all, based on the data, there could be, I would say, some higher declaration in Quebec because we have a bigger, I would say, test capacity. But I would say there is probably not only one factor. There is going to be a combination of factors. It could be in relation with, I remember it again, the school break that arrives before. I would say frontiers were closed. It's also the kind of travels that Quebecers are used to be. As I told in BC, it's almost China who contaminate, I would say, Vancouver, and then China stops the airplanes, so the transition was not there. We used to go to France, to Italy, and Europe a lot. So this probably during the school break was infected a lot of persons, and even after coming back, before the frontiers have been closed. And also there is this New York situation where we have some communities and would see a lot of people from Quebec going to New York. So it's all probably that mix up that make things. One thing is sure is that we had make very early decisions to stop the spread. I think even if we are observing a lot of cases, it would have been worse and very worse, and probably our healthcare system would have been, I would say, in big tension if we had not take those decisions. And now I would say probably we'll see with seroprevalence studies what was the rates of seroprevalence here in Quebec compared to others. And it's only in months from now that we're going to be perhaps answering the reasons why Quebec is more attacked. But it's probably all that kind of combination because we do practice. I want you to remember that Quebecers were the ones who are respecting the distanciation, physical distanciation. So, in fact, it's probably unrelated to the rate of, I would say, virus getting in a place. You cannot do the disease if the virus is not there. You can do the disease if it's coming.
Thank you. Donc, c'est ce qui complète pour ce point de presse. Merci beaucoup et à demain.